Role and Responsibilities of Community and Public Health. Cheryl Haskins, HCA 415. Instructor Dr. Nina Bell, September 22, 2014. Community and Public Health. Health is the concern of just about every human being on this planet. We have one life to live, and as one of my favorite personal quotes, no one gets out alive. Therefore, the realization that in order to live a long life, we turn to ways to promote our health, especially when ill. Therefore, what is health? According to the Oxford College Dictionary, it is the state of being free from illness or injury, and is criticized to be the absence of illness, yet nothing is even spoken of the positive aspects of health. Well, if the common goal seems to be to live a long life, then it would only make sense that it would need to be a healthy one in order to remain from illness and injury. This is probably why the World Health Organization, also known as WHO, notes that health is the state of complete physical, mental, and social well-being, and recognizes the importance of evaluating and improving people's quality of life. Therefore, community and public health roles toward the well-being of population are a pertinent role. Community is defined as a merged group of people with diverse characteristics that are linked by social ties, share common perspectives, and engage in joint action in geographical locations or settings. Public health programs and policy are usually defined as at a regional or national level. However, community is where prevention and intervention takes place, intertwining the two. Therefore, in order to help create ideas and standards on promoting a healthy lifestyle and keeping the population on a healthy track, the process of public health is successful with the help of a community. Public health services directly implement core public health functions such as assessment, policy development, and assurance within each region, state, county, and city, and community health is part of the public system. Therefore, between both public and community, health services are monitored and studied, and new ideas and ways to approach concerned areas are brought to the forefront and implemented into the system on how to keep the population healthy. Public health organization structure. The United States Department of Health and Human Services is a vast organizational chart starting with the Secretary and branching out to different offices of intergovernmental and external affairs with 27 individual agencies, centers, offices, institutes, services, boards, and administrations, making this a large organization that provides monitoring, coordination, and healthy policy formation. This large organization touches so many aspects of life to be able to promote the well-being of the populations because that in itself constitutes the role of public health. From state and local public health departments work with community agencies, and their duties include implementing public programs, monitoring assessing health status, and coordinating fiduciary concerns, including funding allocations. From clinics to health departments and programs such as family planning and WIC to caring for children, the elderly, and disabled, the public health sector branches towards many areas from countrywide to community-wide, promoting the health and well-being of its people. Public health system. The public health system was once thought to only be comprised of official government health agencies. However, the system also includes public sector agencies as well, such as schools, Medicaid, and environmental protection agencies, and land use agencies. Within the system is comprised of 4 components: mission, structure, process, and outcome. These 4 components are what ensure conditions in which people can be healthy, to maintain structural capacity, information resources, organization resources, physical resources, human resources, and fiscal resources, to identify and address health problems, as well as programs to relate towards community priorities and the outcome of the interactions of the public health system. This system, as well as the organization structure, is how the public health sector is able to assess the community's needs and have the assistance in creating new ideas and implementing programs. As we know, the public health system is all public, private, and voluntary entities that contribute to the delivery of health services to its community. This includes public health agencies as state and local levels, to healthcare and public safety agencies, to human services, education and youth development, recreation and arts-related, economic, philanthropic, and environmental agencies and organizations. Therefore, with this structure, the hope is that all aspects and areas of what entails with the public sector is covered to meet the health needs of the community. Legal and ethical dimensions. When it comes to public health, the legal and ethical dimensions or ramifications can be positive aspects or at times even negative when discussing the invasion of individual rights. It is so easy to see the public health in a utilitarian view. Because public health is to help the broad needs of the public, the community, it is easy to convey that the greater good for the greatest amount of people is what is needed. However, the greater good can easily be seen as infringing upon individual rights. Two aspects of the field inspire and motivate: the importance of public health and the constantly evolving nature of it. Because besides the traditional public health concerns like sanitation, environmental, and infectious diseases, public health also focuses on newly emerging pathogens, bioterrorism, and disaster response. Again, for the greater good of the greatest amount of people, never mind how these ideas are implemented and what it may mean for those involved, however, not to be looked upon as the intent of a negative effect towards the community. Although the defining feature of public health is the legal authority of the public officials to impose these ideas for the benefit of society, the basic ethical and legal question is the aspect of the invasion in the interest to protect the public's health. As long as society needs public health, these ethics will stand to help identify the interests at stake, weigh alternatives, consider consequences, and help ensure that the benefits and burdens are distributed evenly. It is easy to see how this can always stand a controversial argument. However, in the eyes of public health officials, workers, researchers, policymakers, and the intent on creating a healthier and protected society, this ethical and legal look in the public's health system is necessary, and that fine line needs to be looked at, dissected, and addressed in order to continue that path to a healthier and protected society. Funding. The majority of public health programs are federally funded and or state operated, such as Medicare, Medicaid, Title V, WIC, SHIP, and CHIP. These programs help ensure that those without health care coverage are able to access the health care needed. However, these programs are based on eligibility stipulations in order to qualify. For instance, the Title IV is a portion of the Maternal and Child Health (MCH) Service Block Grant, this of which was added as part of the Social Security Act. It provides programs for maternity, infants, and children. Title V receives nearly 85% of the MCH funding, which is allocated to the states, and the states in turn allocate funds to local and county programs. The same goes for the WIC program, which offers low-income families the ability to provide healthy foods for their young children, and CHIP, which provides free or low-cost insurance for children under the age of 18. Then there are local health clinics that can be state-funded or privately funded. There are the county health departments, which offer screenings, vaccinations, and much different assistance, which again are funded by the state. Between state, federally, or privately funded programs, there's a vast array of programs available to the public. Communication. Communication is key to the success of any relationship, bar it be a personal relationship or professional. Therefore, the importance of communication is no different within the community and public health sectors. Public health communication would be the art and technique of informing, influencing, and motivating individual, institutional, and public audiences about important health issues, or can be defined as what society does to ensure the condition in which people can be healthy. Therefore, it is important that public health facilitators communicate well and properly with communities on what they offer, as well as the help they provide and the services that are available in order for individuals to take advantage of ways to promote healthy living. Effective communication within public health programs can lead to increased political commitment and program effectiveness by contributing to change in the public perception of an issue, especially with all the available means of communication today. Therefore, communication sits at high importance with every aspect of the public and community health. Even such communications such as anti-tobacco campaigns can lead to widespread behavioral changes and help change social norms, and communication is even more important in the mix of emergencies like communication with first responders, the public, and other groups that may need instantaneous and clear information given in real time during rapidly evolving events. Regardless what facet of public or community health, communication has shown in every corner how important it is, how critical, clear, and concise information can save lives, help a community, and create healthier lifestyles for the public. Conclusion. Their purpose, their role, how they are funded, how they communicate, public and community health revolves around society. They are the means of the community taking care of the community, assisting individuals with healthcare needs that can readily be available when needed. Public and community health provide information, assistance, and aid during emergencies or implement ways to prevent emergencies. Even though sometimes a fine line is drawn between legal and ethical purposes, their entire role is to promote quality and assurance to life. As previously stated, as long as society needs public health, they will be available to assist with the needs of the populations. They are there to educate and promote healthy lifestyles, provide for less fortunate when it comes to healthcare needs, as well as promote ways to prevent illness and injury, which seems to be the entire basis of health. If the goal is to live a long, healthy life, then public and community healthcare are there to assist in that goal, and through federally funded assistance, well-communicated ideas, and innovations, there is no reason why that goal cannot be met.